For more, let's bring in ABC News medical contributor Dr. Alok Patel. He's also a physician at Stanford Children's Health. So, Dr. Patel, 71% of the nation's roughly 40,000 pediatric beds, we are told, are now completely full, the highest in 2 years. I'm curious what you are seeing with your own patients.
Here, we're seeing exactly this, is overwhelmed hospitals, not only emergency departments, hospital floors, but also ICUs, which are critical for those young kids or any kids who develop that high level of illness from RSV where they need oxygen support. What this translates into is two worrisome things. Is number one, the lack of hospital beds, not only for kids with respiratory illness, but all kids who may need hospitalizations. And we are seeing a situation where kids in ERs are waiting hours, sometimes even days, to find a hospital bed across the country. So it is definitely a dire situation that just demands a lot more awareness and prevention.
So it's a stressful time for parents, no doubt. It's flu season, COVID's still here, and now we have this. So what's your advice to parents this winter? Because I've been very transparent about my daughter and son both getting sick, and I'm worried to death because I'm not quite sure what it is and how serious it can be.
Here, I'm with you. Every time my 18-month-old has a sniffle, I'm like, what could it be? You know, I think parents take a breath and realize that you are empowered and there's a lot that you can do. One of the most important things, and we say this over and over again, is to make sure your children are up to date on their vaccines, including an influenza shot for those kids above the age of 6 months, and your COVID vaccines, including everyone in your family. Hand washing, general hygiene, paramount importance. But one of the singular most important things that adults can do this cold and flu season is to stay home or stay away from young kids if you have any cold or flu symptoms, because RSV can appear like a common cold for an adult. It could be a sniffle, it could be a sore throat. You may think it's no big deal and still want to go see your friend's child or still want to go to work where you may interact with kids. You have to keep in mind that RSV can turn into a disastrous disease for young kids. So there are some things that we can do at home. And obviously for that home supportive care, moisture is a good thing to loosen up that mucus. Try to do anything you can to suction out mucus from a child's nose, whether it's one of those bulbs that we give babies or over-the-counter mucus suctioning devices, and call your healthcare providers early if you are worried about anything to prevent heading into the ER at 2 a.m. with a bad outcome.
Yeah, it's great advice. So given this surge, you know, believe me, we're all taking notes, all of us parents. So what is the right time then to take your kids to the hospital? Because we've had talks among parents, you know, high fever, certain symptoms. I mean, when do you know you absolutely need to make that move?
The two most common reasons that we see kids get hospitalized for RSV is when the mucus gets so thick and it starts to move down a child's respiratory tree when they're really having trouble breathing. And you will see them using muscles they don't normally use to breathe. Imagine if your child went and ran a mile and then immediately stopped. That level of exertion is not normal for young kids, or breathing very fast. Also, when we just heard about blue or discoloration on their lips, that's a sign of low oxygen. That is absolutely an emergency. Kids should go to an ER right away. Any change in mental status, Kira, if your kid seems excessively sleepy or lethargic, we worry not only about oxygen, but also about dehydration. So dehydration is an important thing for parents to watch out to. Make sure your kids are taking in plenty of fluids. And if you're worried about any of these symptoms, or if your kid just seems like they're very dry, they're not making as many wet diapers, or their mouth is excessively dry, you also want to seek medical attention.
All right. Meantime, the CDC has voted to add COVID vaccines to a government-funded program called Vaccines for Children, helping to make COVID vaccines free for kids once the government stops providing them. So how important is that? How do you see that playing out?
Well, it's extremely important. I wish I could give you a high five through the screen, Kira, for actually mentioning the Vaccines for Children program, because that was the importance of this vote. The Vaccines for Children program basically ensures that children who don't have health insurance or can't afford vaccines have access to them as well. And the CDC actually put out an analysis a few years ago estimating the VFC program, which is federally funded, like you mentioned, has saved about $2 trillion in societal costs and over 900,000 deaths because they provide equity in terms of vaccine distribution. So that was a good move by the CDC.
Happy weekend, Dr. Patel. Thanks for all the good advice.
Happy Friday to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.